Alrighty, so this is Doc here. I'm going to be going ahead and doing a heart and lung auscultation. So dogs have 9 quadrants in their lungs, so you want to make sure that you get every quadrant. So I have my stethoscope here, and I'm going to start listening to his lungs. You want to make sure that there's no wheezes or coughs or anything like that. Alrighty, that side sounds good. Perfect. And then you also want to check their trachea. Make sure everything sounds good there. It does. Perfect. So go ahead and check his heart. And make sure that everything sounds normal. You want to listen for rhythm, perfect rhythm. You don't want to hear any whooshing or anything like that. You want to hear nice, clear, definitive sounds. And then also find his femoral. Good boy. And make sure that both of them are synced up and have the same intensity. Alright, perfect. So, since he's a little excited, his pulse is about 100, 110, which is still normal, but other than that, that is how you would go ahead and do a heart and lung auscultation. Okay, so now I'm going to be showing how to use an EKG or ECG. So first, we'll turn on our machine here. And then while we're doing that, we're going to go ahead and place our lead. So we have a white, a black, and a red one. So white goes onto the right side, just above his elbow here. And then the black goes onto the left side. And then however people remember it most often is smoke over fire. And so I'll place this above his knee as well. And then in order to get correct reads, you need to place some alcohol on each lead. Alrighty, place it here, just like so. Alrighty, so now our EKG is going. Alright, I see his pulse, and you want to make sure it's on the correct setting, so we'll go to admit here, and he is on large dog, so perfect. Alright, and then now we're going to go ahead and take a strip of his EKG to go over later. I'm going to be going over Dunn's EKG, or also called ECG. So kind of wrote on here to kind of better see everything. His looks completely normal. So when you're reading an EKG, you want to make sure that you have a P wave for every QRS wave for every T wave. And so you'll see P, QRS, T, P, QRS, T. It just keeps going and going, and so his EKG looks perfectly normal. If any one of those was missing, then there'd be something wrong. His QRS wave is nice, tall and strong. Anything like that would be considered an arrhythmia. Anything that could be abnormally normal could be sinus arrhythmia and things like that. But so far, Dunn's EKG looks great, and that is how you do an ECG. Now I'm going to be showing how to use a rabies pole to help restrain Dunn here. Dunn, he's a fairly friendly dog, so we don't currently need it, but in case he was going to be a possible rabies suspect and or aggressive dog, we have our pole here, and the loop at the end gets tightened by here, so you pull on the end, and that's how you tighten it, and then to release it, you let go, and you pull back again. Alright, done. Alright, so we place it on top of his head, just like so, and then we tighten it, just like that. And that way you're able to keep a distance from yourself, for your safety and for their safety. And then to release it, you just pull back again, and unloop, and just like that. And that is how you use a rabies pole. Now I'm going to be showing how to collect free catch urine. I have my urine pole here, so you want to get it midstream, so once he goes and starts urinating, we'll let it go for a second, place the pole collect a couple more seconds of urine, and then we don't want the end of it. So without further ado, go potty. Go potty. Alright, so you're able to catch a tiny bit of urine here. The reason why you want to do it, thank you. The reason why you want to catch it midstream is so that you don't catch any bacteria that could be in the urethra. So go ahead and pull up our urine here. And that is how you catch free catch urine. Okay, so now I'm going to be showing how to disinfect a kennel. So I have some chlorhexidine here. This pretty much kills everything, but contact time is very important, so it needs about 5 minutes. So I'm going to go ahead and spray it inside pretty heavily. And then spray this part as well, and then we'll let it sit for 5 minutes. Okay. So it's been 5 minutes, so we're going to go ahead and wipe down our kennel. So start with the top here. So we'll go ahead, wipe it down, and then we'll go to the back and make sure we get the corners nice and good. And we'll go from the sides. Alrighty. So that's good. So then, in order to have a perfectly sterile cage, you have to do the kennel door as well. And also the outside. Alrighty, and now that is ready for the next patient. That is how you disinfect and sterilize and clean a kennel. Now I'm going to be showing how to place a urinary catheter. This is our patient here. He's under anesthesia currently. He just got done with the neuter. He has a very full bladder, so we'll need to express it and then also collect a sample. So first I'm going to go ahead and scrub. So I have my scrub here. I'm going to scrub around his prepuce. And you want to do it in circular motion. And I'm not going to go very much farther just in case I get into his surgery site. He kind of urinated a little bit, so we'll go ahead and clean up a little bit more. Okay, I'll do one more scrub. Typically do about 3 of these. Alrighty, so now that we are scrubbed, I'll go ahead and create my sterile field. So, I have my gloves. Go ahead and open it. Surgical sterile gloves. And create a sterile field. I'm folding it ever so. Alright, so now that is my sterile field. So now I'll take my sterile lube and place them in the corner here. Just like so. And then also grab my syringe. Okay. Now I'll go ahead and place my gloves. Okay. Okay. Okay, and then here is our other glove. And just this one. Okay, just like so. Okay, so now I have my sterile surgical gloves. Now Andy here is going to shake out a catheter for me out of its sterile tubing. Alrighty. And so you can kind of bend it a little bit so that it stays into the surgical field. And then we'll lube it up pretty generously. Okay. Alrighty. So now Andy is going to help exude the penis. Okay. I'm going to go ahead and place a catheter, and then we're going to feed it All right, so we got some urine flushing. I'm gonna grab my tubing. So commonly, what you'll feel is the bend around, so you have to go around that bend in the urethra to the bladder. And so we'll go ahead and start sucking up some urine. Go a little bit farther, just around that bend. Alrighty, and there we go. All right, and that is how you collect urine via urinary catheter. All right, now we're going to be showing how to do a cystocentesis. Danielle's helping me restrain. This is Dr. Lance. She's going to be doing the cystocentesis. So she has alcohol that she is applying to Penny, our patient here, right above her bladder, and she has an ultrasound. She's going to be using the probe for the ultrasound to find her bladder. It's going to be this dark round blob on the screen. And then she has a needle here, or a syringe with a pretty long needle in order to reach the bladder that she will insert once she finds the bladder in the ultrasound. So, ready? So go ahead, yeah. So we need to show the bladder. Okay. Okay. And so she's going to go ahead and insert the needle now, and she's going to draw back, and you can see the urine flushing in the needle. And then we'll take that out and we'll be able to run a sterile urinalysis, which is why we like to do cystos, and that is how you do a cystocentesis. Now I'm going to be showing how to use a Schirmer's test. This is done here. We're going to be testing one of his eyes. So the Schirmer's test is to check to see if his tear ducts pretty much are working properly and not overproducing. So we'll go ahead, use the very end, and we'll put it in his eye here and hold it, and we'll hold it for 60 seconds. Alright, so it's been about a minute, and we'll go ahead and remove. And so pretty much you want between 10-15 seconds. So here you can see where it kind of went from, if it can focus. Anyways, that's 5, and then 10, and then 15. So it's right in the perfect range. It's producing enough. It's not producing too much. It's because you're also checking for underproduction. So otherwise, that's how you do a Schirmer's test, and everything's normal. So now I'm going to be doing some tonometry of Dunn's eye here. So first we're going to apply a proparacaine. This is going to help numb his eye, make it more comfortable. So we'll put a drop here. And while we're waiting for that to take into effect, we're going to calibrate our shots. So currently our tono pen is getting repaired, so we are breaking this thing out. So I'm going to go ahead and calibrate it, and we go ahead and tap it here and make sure it reaches to 0, and it is. And then we're going to go ahead and place our weight. And this little sheet here is to help decipher the correct values and things like that. Okay, so go ahead. I'll take a reading, and notice how Haley here is holding Dunn's head to not hold off any blood vessels or anything, because we're testing for the blood pressure in his eyes. So go ahead and tap it straight up and down. Okay, so that's 1, 2, 3, perfect. So we got 3 readings. Each time it was 15, 15, and 14. So according to our shots here, under the 10 gram weight, not 10 pound weight, 10 gram weight, he was 15, 15, and 14, which is completely in the normal range. And that is how you do tonometry. All right, so now I'm going to be showing how to do a fluorescein test. So I have the tab here, it's the dye. This is Sophie. Sophie's a puppy. We're going to be staining her eye to see if she has possibly any ulcers. That's what the stain picks up. The ulcer will pick up the stain, and then we'll be shining a blue light here to see if the ulcers are there. So I'm going to go ahead and open up my tab here. And for convenience's purposes, I'm going to take the stain off the tab, and I'm going to place it in my syringe here, just like so. And then, using some sterile water, very carefully not to allow any stain to go back in, I'm going to draw up some water here. It's about so. And then, as it turns the bright color, we're going to go ahead and place it into her right eye. A few drops here. Her eye is very sensitive, so just a couple drops, perfect. And then we'll let her blink a couple times, get the stain all good in there, and then I already have some sterile water pulled up again to help rinse her eye. Oh, I know, Sophie. Good girl. Just a couple more drops. Oh, you're doing so good. Alrighty. So then, what we should be able to see, the doctor will take a look and her eye will get nice and blue. We'll turn out the lights, but if she does have an eye ulcer, it will turn nice bright, it will contrast with the blue light, and that is how you do an eye stain. So I'm going to go ahead and show how to do anal gland expressions on the dog. I'm going to be doing these ones internally, so it's best to describe it first before I actually do it. So what I'm going to do is take my finger, add some lube to it, insert it into the anus, and then I'm going to hook around and kind of milk the anal gland. You'll be able to feel it, both of them on each side. They're about at the 5 and 7 o'clock-ish range, somewhere around there. And you'll be able to press it and pull, and then it'll be able to express outward. So I will go ahead and start. His tail. This is Tully. This is one of our doctor's dogs here. And this is Danny, and she is helping me by restraining. And so his anal glands are fairly large. So I'm gonna go, there we go. It's best to have a paper towel ready in case it starts to shoot out, just like so. And so I'll go ahead and express both his anal glands here. His anal glands are very full. Alrighty. And then afterwards, I've got some cleaner here. I'm probably going to take my gloves off and clean his butt, but I have cleaner and some perfume for owners if you were going to be sending them out the door. And that is how you express anal glands. Now I'm going to be showing how to administer an enema. Down here doesn't necessarily need an enema done, so we're going to go do everything up to the insertion point. So I have some warm water here in my bin that I'm going to apply some Septisol to, just to kind of get it to be nice and good, because sometimes the doctor will order that. And so then I have my syringe in order to apply it, along with some lube and our catheter tip in order to administer the enema. So go ahead and open it. Alrighty, open up our syringe. Alright, ensuring that it fits, and then we're going to go ahead and pull up our solution. And then we'd go ahead and apply some lube here to the tip. Alrighty. And we'd apply it here. And then Haley's going to hold up his tail, and then we'd go and we'd insert it just like so, and then we would flush. And when you're done, you'd remove it just like that. The reason why you'd want to do an enema, the reason being for therapeutic reasons, is if they're blocked up, if they're constipated and it's going to cause them bad responses, you know, going to cause toxicity, some kind of obstruction, anything like that. The enema would help, you know, release that, loosen it up, and allow them to have a normal bowel movement. Now I'm going to be showing how to apply a topical medication. So my cat here, Bunchy, he gets Bravecto quite often, every 3 months, because I work at a veterinary clinic and I don't want to take home any unwanted parasites of any sort. So what you want to do, I already have it pre-opened here, especially for cats. You want to get it pretty much on the back of their head. I've used it lower and he's been able to lick at it. So what you want to do is just kind of spread the hair. We can even blow on the hair if that helps, and then go ahead and apply it. I know, and he's had bad experiences with this before, so he gets a little jumpy with it. Good boy. And you want to make sure that you get it on his skin, and that's why we are separating his hair. All right, and that is how you apply a topical medication. All right, so now I'm going to be showing how to clean and flush and medicate a dog's ears. So this is done here. We're going to kind of just quickly flush his ears first. What you want to do, you want to visualize the tympanic membrane, make sure everything's normal, just to make sure you know it's not damaged or anything like that before flushing, medicating. So I'm going to go ahead and use my otoscope here and visualize the tympanic membrane. Good boy. Good boy. Good boy. Alrighty. Have it visualized. It's got some waxy debris in there, so you do that with both ears. But for time's purposes, we're just going to do one. So we're going to go ahead and get started. Beforehand, I already did visualize both his tympanic membranes, so they're good to go. So first I'm going to use some dilute betadine here, and this is Andy here. She's one of our technicians, so she's going to be helping me restrain. I'm using dilute betadine with an ear bulb, and I'm going to go ahead and start flushing his ears. You want to get it nice far down into the ear canal, and go ahead and start flushing. Good boy. Go ahead and flush a few times. It's okay, baby. Sometimes it's really uncomfortable for kiddos to get their ears flushed. Alright. Do it one more time. Good boy. And we'll kind of gently pull the water out of his ears. Good boy. Very good boy. Alright, do this one more time, getting the water out of his ear. We'll go ahead, we'll dry it. Dry the outside and the inside. Alrighty. Good boy. You want to make sure it's nice and dry before you apply your medication. In this case, we're going to be using our Animax here, or the Quadra Drop. And then we're going to be using a couple Q-tips to get farther into the canal to help continue to dry it. And then also this is a good checking point to see if there's any remaining wax. Good boy. Okay, do one more Q-tip. No, good boy. Almost done. Perfect. And then he would go and if his ears were still, you know, if he was coming in for an ear infection, we would go and we'd double check to make sure that we have his ears completely cleaned. Alrighty, looks good. And then we'll go ahead and apply medication. Just put a few drops here, just like so, and then you'd rub it in, just like so. Alrighty, and then you do the same thing for the other side, and that is how you do an ear flush on a dog. Now I'll be showing how to flush and clean and medicate a feline's ears. This is Newton, my preceptor's cat. Newton has been known to be a little crabby, so she did sedate with some gabapentin this morning. But he does need an ear flush and ear cleaning, so we're going to go ahead and start with some epiotic. That's what she prescribed for him to flush and clean his ears. So what we're going to do is we're going to put it in his ears, put these cotton balls there, and squish around. And we fill it up all the way to the top of the ear. Go ahead and do that. You want to make sure that you're squishing back here because that's where his ear canal all the way goes around. I know, Newton. Good boy. Good boy. Alright, so that ear's done. It's got some pretty clean ear on that side. We'll go ahead and do the other side. Good boy. I'll do the same thing for the other side. Maybe this ear is the dirty ear. Alright, make sure we get it nice and massaged in there good. And then, yeah, so you see that ear kind of got more there. And then go ahead and use some cotton balls, just kind of dry up the area. So we don't want that extra moisture just to be hanging around. Got some Q-tips, gonna go in there and actually soak up all of it. And make sure, and this is also a good telltale to see if we have fully cleaned their ears. Go ahead and do this one more time. I know. Alright, so that ear is good to go. And then I'll go to the other ear, the dirtier ear. I'll dry off his outer ears, and I'll make sure we got all the epiotic out of this side. And this is Andy. Andy is one of our technicians here, and she's helping me restrain. She's doing a great job holding him in a burrito style to make sure he can't swat at me, even though he's declawed. Alright. Okay, and then I'll use a Q-tip again to go on the inside of the ear canal and to kind of grab the rest of the wax and to also clean and dry up the epiotic. Good boy. And so when you're doing ear cleanings, you want to make sure that you get almost all the wax out as you can. That's looking pretty good, so we're going to apply the next treatment order, which is the medication of the Animax or the Quadra-Drop. It's an ointment that we like to put in ears, especially irritated ears. So I'll put a little bit in this ear, just a nice drop, rub it around his ear a little bit, make sure he gets all of it. And then we'll kind of put a thicker drop in this ear, because this ear is the definitive problematic one. And we'll massage that one in. Oh, good boy. I know. Alrighty. And that is how you clean and medicate a cat's ears. Now I'm going to be showing how to give subcutaneous fluids. This is Kuma here. He's one of our patients who needs some fluids to be rehydrated. Fluids for subcutaneous purposes can be used to help rehydrate a patient or maintain their hydration. So this is Patrick here. He's going to be helping me restrain. Kuma's a pretty good kitty, so he's just going to be bribing him with head scratches. It's important to have a new needle so that you don't introduce any bacteria that could cause infection. So I have some LRS and my 60 ml syringe here, and I'm going to go ahead and tent the skin to make sure that it's subcutaneous, and then poke in the tent, and then draw back so that you're not and a blood vessel at all, so no blood. And so we're going to go ahead and give the fluids. Oh.
He squirmed away a little.
Okay. And sometimes you'll have to move around in case, as you see, we already gave him 60 mils before, so they have to move around in order to give fluids, or if they kind of move around because it is kind of uncomfortable to be given fluids so much at a time, you'll have to redo the injection. Okay, you went ahead and you want to go ahead and pinch the spot where the needle was, because sometimes it can leak, and that is how you give subcutaneous fluids. How to do a toenail trim on a dog. This is Tully here. This is one of our doctor's dog. He's a very good boy. So I'm going to go ahead and trim one of his feet. He does have a dew claw here at the front, so whenever you're trimming toenails, make sure you get their dew claws. So I'll go ahead and trim. And this is Danny here. She's helping me restrain. She's holding the head back and holding the arm for me so he doesn't move. Alright, so trimming his toenails, you want to be careful of the quick. In case you do happen to hit the quick, what you would do is you grab a wet Q-tip and you'd place it in some quick stop to get it on there, and then you'd go ahead and tap the end of the nail and kind of press it in. And what a quick stop has some lidocaine in it to help with the pain and helps this bleeding stop. If you're at home when you're doing toenails and you happen to not have quick stop, you can also use cornstarch to help stop the bleeding. And with this last foot, this last toenail, all set. And that is how you trim toenails on a dog. Now I'm going to be showing how to do a cat's toenail trim. This is Bunchy, my kitty, so I'm going to go ahead and use some cat toenail trimmers. And in case I accidentally quick them, I have some quick stop here. So for cats, you want to press on the top of their toes to push their toenails out. So this toe is pretty short. I might just tip it a little bit. I trim them at home. So then go to the next one, and go to the next one. And just keep pushing out. That one's good. And then you always want to make sure you get to the dew claw. And so say I accidentally quicked them with this one. The quick is that bright pink spot on their nail bed right there. It was full of blood vessels and nerves and hurts quite badly if you do it. So some quick stop here has some lidocaine in it that helps with the pain and helps stop the clotting. So I just press down on there, pat it in, and just like so. And that's how you trim a cat's toenails. Showing how to apply an emergency compression bandage over the abdomen. So done here, he doesn't actually have anything wrong with him, but say he had a big old wound here that we needed to apply a lot of pressure to so that there wouldn't be any leaking or anything like that. So I have my gauze here and my vet wrap. So I'm going to go ahead and place it over his big wound and I'm going to reach around him. Okay, I want to make sure it's nice and tight just so that nothing can leak, but we won't want it too tight. That will inhibit his breathing. So we'll just keep going around, just like so. And this is to apply in case of emergency, just in case, you know, it's a life or death thing and the doctor needs to come in. So you do something along those lines where you get nice and constricted, not too tight where he can't breathe and things like that. And that is how you would apply an emergency compression bandage. To apply a Robert Jones bandage along with a splint here. So we're going to go ahead and start by placing our stirrups. So we're going to have some tape. Put this along. And I'll get another piece of tape to apply on his other side. We'll go ahead and place it about there. And then apply our tongue depressor to the tape, which will help us after we are done placing the stretch gauze. And we'll go ahead and place the other stirrup. Okay, and now we'll go ahead and place our stretch gauze. I'm using 2-inch. And we'll stretch out the foot here. And we'll go all the way up to his elbow. And then we will go back down. Okay, we'll go ahead and apply another one. So Robert Jones bandages help with anything from a wound that needs extra padding, from a sore or torn ligament, to a broken leg that is almost to recovery, things like that. Or, needing support before we go and cast the leg. And when you're applying the stretch gauze, you want to make sure that you cover about 50-50 from the last time, maybe even a little bit less, just kind of depending. And just keep going around, just like so. And this is done here. Done doesn't actually have anything wrong, but we're going to go ahead and place it anyways. And this is Haley. She's helping me restrain. And she's holding behind the elbow in order to make sure that his foot is stabilized. So we'll keep going all the way up. Just like so. Okay. And so now we'll go ahead and apply this. This is going to help stabilize. And with this one, you don't want to pull too tight. This is just going to help keep the gauze in. So you want to pull it just like that. So we have that applied, and so now we're going to go ahead and apply our splint. Okay, and now we're going to go ahead and remove the tongue depressor for our stirrups. So here's one side. We want to make sure that we see his digits, just to make sure that there's no swelling, and you can, conveniently check to see if there's any moisture in the wrap, things like that. Alrighty. Just like that. And then we'll go ahead and apply our vet wrap over our Robert Jones bandage and our splint. Yes, thank you. And vet wrap can be too restrictive, so you want to make sure it's not too horribly tight. Kind of go around and then you pull. Just like so. Okay. You want to leave a little bit of the cotton at the top just to avoid irritation. Clear that. Okay, and we can go ahead and feel his toesies here. And there is his Rapid Jones bandage, and that is how to place the splint. Okay, so now we're going to go ahead and remove our wrap that we just placed. So starting with the vet wrap, we'll go around and remove it. And Haley here is still stabilizing it for me. Okay. Remove the stirrups. Alright. Remove the cling that is holding onto our splint here. Okay. Alrighty. I'll go ahead, do the same for this, and even use our scissors here and just start slowly peeling away at the layers. You don't want to try to go any closer just in case you don't want to accidentally cut them or anything like that. So we'll just slowly trim away. Good boy. Okay, and then the last little bit, I can just kind of pull off. And say if he did have some kind of wound that we needed the doctor to take a look at, we would save this dressing in case there's any discharge or anything like that. And then slowly take it off, and then we take off the stirrups, just like that. And that is how you remove your splint and Robert Jones bandage. So now I'm going to be showing how to do some dental radiographs. This is Molly, our patient here. She might have to have a tooth extracted, so we're going to go ahead and take a look at the roots. So what I'm going to do here is we have our plate, and we're going to stick it right underneath the problematic tooth, right there. And then we're going to angle our x-ray machine so it's at the angle that it needs to be, about right there. And then we have a remote, so we're going to step out of the room. I do have my personal protective equipment on, my thyroid guard and my apron, but we're going to step 6 feet away, and then we're going to go ahead and press the button until it beeps. Alright, and that is how you take a dental radiograph. How to do hand scaling. This is really helpful for doing detailed things like getting in between these little cracks here. You want to make sure you go away from the gum so that you don't accidentally damage it. For big things like this, the electronic scaler is going to be perfect. So I'll go there and kind of scrape away. You can see that's a lot of plaque, so we'll definitely move on to the electric scaler. But that is kind of how you do hand scaling there. And then for the electronic scaler, kind of loop it here. And then for this one, you don't want it to be on the tooth for more than 15 seconds. If you do it for more than 15 seconds, it could possibly burn and damage the enamel. So you kind of want to be quick with it. And I have a little button here that helps spray water at the same time. So you want it to be towards the tooth and angled, because if you do it like pointed like that, that's too concentrate and could also damage the enamel. Alright, and so then after we're done scaling, we'll probe it for any pockets and then go ahead and apply our polish. And that's how you do dental scaling. Alright, so now that I have gone through and scaled through Remy's teeth here, I'm going to go ahead and apply some of our polish here. With our polish, it has some granules in it, so in order to not damage the tooth and the enamel at all, we're not going to be on there for very long per tooth. We're just going to be there max 10 seconds and to make sure it's nice and clean and polished and good to go. So I'm going to use my polisher here with our polish. And go ahead and polish this tooth nice and fast, just like so. That's how you polish teeth during a dental cleaning. Okay, so I'm going to be going ahead and doing a mock dental discharge with Dr. Davis, my preceptor here. So Benny here was here for dental. We have some discharge instructions here. Benny, because he was under anesthesia today, is going to require special precautions. So he may be a little wobbly. Some mild nauseas also can happen. So feed 1/4 of his normal food. Watch for any loss of appetite for over 2 days. Refusal to drink water for over 1 day, depression, weakness, diarrhea, vomiting more than once, or excessive pain or discomfort. No food until after 6 p.m. That's when you can start feeding the 1/4 cup of his food. If he handles that okay, then you can go ahead and give him the rest of his meal the next day, along with water if he tolerates it. He can resume normal activity today. He didn't have any extractions, so he can, no soft food or anything like that. Let's see here. We also updated his vaccines and things like that. He may be a little whiny tonight because of the anesthesia and just kind of feel off on his normal foot. So his teeth cleaned up nicely, but we wanted to stay that way and stay nice and clean at home. So we have these little kits here for keeping their teeth nice and clean at home. So we have this nice little toothbrush and a little coupon for toothpaste. The toothpaste is flavored, so it can be like a nice little treat for him. Have you brushed his teeth at home before?
No.
Okay.
No.
Okay, so what I like to tell people is that with toothpaste, just give them the toothpaste first, just as a little treat. Don't do the toothbrush, don't stick your finger in there, just to get them used to it. And then put a little bit of toothpaste on your finger, and then just kind of rub around their teeth a little bit, just to kind of get them used to having something in their mouth that's not usually there. And then switch over to the toothbrush and only scrub the outsides. Insides are okay, just the outsides. And that's how you would brush your teeth at home. Do you have any questions on that part?
No, I think we're pretty clear.
Okay. Another way that you can kind of help with his dental care at home is a product called Healthy Mouth.
Okay.
You make a jug of water, and that's something that they drink over time, and that also helps prevent dental decay. Decreasing treats and stuff would also help with keeping his mouth nice and healthy and clean, because treats can cause some bacteria build up. And then also we do offer Science Diet TD, which is the dental care food from Science Diet, and it's a prescription food, so you have to talk with your doctor about it first. But it's this big giant kibble that they chew on, and that helps with dental decay as well, or preventing it.
That sounds amazing.
Yeah. All right, any questions?
No, I think I'm good to go.
Okay, there you are.
Thank you.